Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Well, September is Ovarian Cancer Awareness Month, and nearly 85% of women with advanced ovarian cancer are going to face a recurrence of this disease. Joining us to explain more about the latest in ovarian cancer research and the treatments is Dr. Robert Holloway, and he's joined this morning by Ann, who's going to share her personal experience with ovarian cancer. Welcome to the program, both Dr. Holloway and Ann. How are you both doing?
Thank you, Neil.
Thank you, Neil. Doing well. Hope you're doing well also.
Absolutely. Great. Thanks for taking the time. Well, Dr. Holloway, talk to us a little bit about ovarian cancer and about the latest ovarian cancer diagnosis and treatments.
Thank you very much. As you mentioned, approximately 85% of patients with ovarian cancer who are treated with surgery, chemotherapy, go into remission. Unfortunately, about 85% of those patients will have a recurrence of their disease and require more treatment over time. What's really new about ovarian cancer is these are therapies to be given into a treatment response with your recurrence. And that has allowed women to live with this disease much longer in the United States, especially that we have now about 225,000 women in the United States with ovarian cancer. That's quite a change over the past decade.
You say maintenance therapy?
That's taking a therapy beyond your treatment for the recurrence of disease. So patients who recur with their disease will go back onto chemotherapy regimens, and they'll get a response, meaning a reduction in disease. And many of those women actually go into a clinical remission where the disease cannot be found on a CAT scan. But instead of taking the watch and wait approach for it to come back, you can now go on to a maintenance therapy to maintain that remission.
It's ongoing treatment.
Yes, sir.
And tell us about your journey with ovarian cancer. When were you diagnosed?
Oh, thank you so much for asking. So basically, in 2015, I was having some issues and went immediately, got it checked out. The feedback that I got was everything looked fine. It was suggested that perhaps I follow up with a specialist, but honestly, I heard the word fine and didn't do anything else. Fast forward 6 weeks, I was experiencing excruciating lower back pain and went to an emergency room, and unfortunately, at that point, CT came back, and the doctor, I'll never forget, it was at midnight, and he said, your abdomen is flooded with cancer. And we were devastated. 2 days later, emergency surgery, 7-hour surgery with a lot of body parts removed. It was determined that I had stage 3C ovarian cancer, which, as you can imagine, was devastating. What happened with me, which happens with many of us with ovarian cancer, is I'd completed my chemotherapy regimen, and about 6 months later, I recurred. And, I had gone to get a follow-up. I just didn't feel right. Mm-hmm. And I knew that the cancer was back. And so I reached out to my oncologist, had some lab work done, another CT scan, and once again, the cancer was back. After another 9 months of chemo and being told that most likely I'd be on chemo the rest of my life, my husband and I were thrilled to find out that I was a candidate for this maintenance therapy.
Dr. Holloway, how typical is Ann's story where the cancer has developed over quite some time and then being told that everything's okay, and then in 6 weeks, it's in full blown, you have to have emergency surgery? Is it that slow acting in the initial stages?
Her story is actually very typical. And I think, one of the things Ann, says is that she felt these symptoms for a while, and that's actually been seen that oftentimes there are several months of symptoms before a patient gets diagnosed. And so one of the messages we have for women, being that this is Ovarian Cancer Awareness Month, is listen to your bodies. And if you're experiencing pain that's not being explained, go back and get checked out again. That things change over time, but don't ignore them, and try to get diagnosed as early as possible.
Are there treatments in preventing recurrence? once it has reached such an advanced stage, or is this pretty par for the course as far as what Ann has told us?
You're exactly right. We do have new treatment options, and this story is very typical that Ann has told, but what's new today is that we have maintenance therapy options, which are oral therapies once a day, so we're not talking about ongoing IV chemotherapy. And I, too, would consider her a candidate for this therapy. It's called Zejula. It's a once-a-day oral. Like therapies, all cancer therapies, there are side effects. It's important that you ask your doctor about the side effects, the risks and the benefits, and you can read about this yourself on Zejula.com. But it's an excellent option for many women to help maintain that remission and stay off IV chemotherapy.
And is there anything that you can think back on that maybe you could have done differently to, I guess, speed up or find out what your condition was a lot sooner? And if there was something that you can remember, what would you tell other women who may be facing your same situation?
Well, what's interesting is I did go to the doctor and had an ultrasound, and nothing showed up. So, you know, the symptoms I had were very similar to someone going through IBS. My stomach was bloated. I felt full after eating just a little bit. I just was kind of run down. But I traveled a lot for work, so I really didn't think there was anything more than maybe it was just postmenopausal. Long story short is listen to your bodies. That's what I would tell the women. Listen to your bodies, advocate, get a second opinion, and don't ignore your gut instincts.
How can we get involved as listeners in ovarian cancer research and awareness being Ovarian Cancer Research Awareness Month? Is there some place online that we can go and get involved and get some more information?
Absolutely. I would recommend that you look for the Foundation for Women's Cancer. It's a foundation through the Society of Gynecologic Oncologists, has a lot of information about ovarian cancer signs, symptoms, treatments, and research opportunities going on in the United States, and places for patients to advocate and get involved with ovarian cancer research are found on that website as well.
Right. Well, I certainly appreciate both of you coming in and speaking with us, Dr. Robert Holloway and Ann, and I'm wishing you all the best, Ann, and thank you so much for joining us both today.
So much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm